take some time today to learn about how to transition into 2021 successfully with Parkinson's. To help us do that is our speaker, Kathy Huynh. Kathy graduated from UCSD in 2000 with a bachelor's degree in biochemistry and cell biology. Just translate that into she's smart. She became a registered nurse in 2007 and then went on to obtain her master's degree in nursing from Samuel Merritt University in 2010. For those of you who receive care through the Parkinson's and other movement disorders clinic at UCSD, also a Parkinson's Center of Excellence, Kathy is their lead nurse practitioner and is likely a big part of the care and support you receive in living with Parkinson's. I know she certainly is in John's and mine. In addition, Kathy is currently involved in helping develop the Parkinson's order set that will be part of UCSD's electronic database known as EPIC, so that should you arrive at their emergency department, staff will know how best to deliver medical service without compromising your Parkinson's. And if you're not a UCSD patient, once this program is up and running, it will be disseminated to the other hospitals throughout the county. So without further ado, I'd like to turn over the floor to Kathy.
So thanks for having me. Happy 2021. I know everybody's hoping that this year will be much better than last year. So my hope is today that I talk about things that I feel in my practice that I feel provides a good foundation for people to live, how to live well with Parkinson's disease. Because this is more of like a foundation talk, some of this, I apologize if it's, very simple and basic to you, because I know many of you have become PD experts over the years. And some of these may appear to be common sense. But as you know, living with Parkinson's disease isn't simple. It's not always straightforward. And because of the stress and all the, you get bombarded with so many things that sometimes we lose sight in the direction of where life should be. So my hope is I kind of pull all that back together to remind you how to simplify what is important in the perspectives that you need to take to be able to live well from PD from a medical care perspective. We all know Parkinson's disease has implications from a physical, cognitive, and emotional perspective. It's a very complex interaction between social, health, all these aspects. And I always felt like part of my job when I see a patient is to help provide a little bit more focus, especially if they're just all over the place, not really knowing what to do. They have a lot of concerns. And I feel like my job is to kind of put everything together for them, provide them some focus, simplify their goals so that hopefully things seem less overwhelming. And in general, just like building a foundation with anything, whether it's learning a new skill or a new job set, we know that if you have a foundation, it's easier to build on top of that, right? So you tack on one skill set, you tack on another new job, and we can build on top of that. And for people who have weak foundations, those are the people who struggle much more. So that's one reason why I wanted to focus my talk on this. I purposely did not include resources except for a few exceptions. However, we do have resources, so I'd be happy to provide those if you guys have it. I more wanted to focus on the principles rather than throw a bunch of resources at you, but we definitely have resources if you want more details. Okay. In my view, when I'm talking to somebody, I'm always looking to take care of their physical, cognitive, and mental health. Without that basis, it's hard to really improve your life and to get you to be able to move forward in Parkinson's disease. I like to tell people how to get involved and not just focus their life at home within the focusing on Parkinson's within their home. I do think future planning is important. It's a source of stress when people are not prepared, obviously. And I usually like to talk about the care partner because, of course, their role is huge in with somebody with Parkinson's disease. Okay, so taking care of your physical health. As we all know or should know, exercise is the mantra of Parkinson's disease. And I've always felt my philosophy is that if you're not sick of me hearing this, I'm not doing my job. So you're going to hear a lot of this. You have to exercise, 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 exercise. Now, why? There is some evidence that it could be neuroprotective and increase neuronal plasticity. Now, we can't regenerate the cells, but what we can do is perhaps with exercise, improve the connections between the cells. And so some of the studies have shown that. Because of this, it potentially could help reduce the medications that you take. And sometimes if I have trouble motivating a patient to exercise routinely, I tell them, hey, it's either medicine or exercise, you pick. And so we can usually tell who exercises routinely, who doesn't. And I think most of us would pick exercise over taking more medicines. Of course, it improves your motor symptoms, okay? Helps you walk better, reduces falls, improve your function. It also helps non-motor symptoms. So that could be your sleep, your mood, your cognition, and your fatigue. And due to this overall, and of course, you know, we have our basic health, right? Your heart, your lungs, improvement on all of that. And all that combined together improves your quality of life, which is to me, the ultimate goal of how to live well with Parkinson's disease is how do we maintain our quality of life? Now, I do see a lot of issues when it comes to exercise when I recommend it. So that's where I kind of want to see, and yeah, I'm not focusing this talk on medical therapy as much. I more want to teach you things that you could do on your own without needing medicine. But if we want to talk about medicine, I can do that too. So issues I commonly see, or barriers that I commonly see that prevents one from exercising. Fatigue. So fatigue is huge. It's a very complex issue, difficult to treat. So the first thing I always like to do is to make sure that the person is seen by their primary care provider to rule out other medical causes, such as hypothyroid. Okay, and then we want to look at what we do have control over to improve our fatigue. And that is namely sleep and making sure that REM sleep behavior disorder is under control. So in Parkinson's disease, we know that sleep issues are one of the early signs that can happen decades beforehand. So it's important to get that under control. And there's REM sleep behavior is acting out of dreams, talking in your sleep. When you sleep, the goal is to get into that deep, deep sleep to get you that rested type of sleep. So I always tell my patients, it's not just a matter of how many hours are my eyes closed. I need you to be able to get into that deep stage of sleep. And if you're acting out your dreams, talking in your sleep, you're not getting into that deep sleep that you need to feel rested. And we like to treat that with melatonin, just over-the-counter melatonin. Orthostatic hypotension is common in Parkinson's disease. So we want to make sure that you rule that out. So if there's any lightheadedness, we want you to make sure you tell your provider and have that checked out and treated if needed. Now, you want to, things that you can do to encourage yourself to exercise when fatigue is a main issue. You want to exercise when you're at your best. For most of us, that's early in the morning. And if you're tired afterward, that's okay. Because I think for some reason, a lot of us feel guilty for napping or feel like that shouldn't be right. I shouldn't be so tired after I exercise, but that's okay. I mean, you want time to exercise and you want time to rest. And if you need that nap, take it. Having a consistent exercise routine helps, and it helps to have a designated time. So that way you're not making yourself do things. Instead, it's an expectation. You know that I wake up at 7, I eat at 7:30, and 8 o'clock I exercise. And it's a habit. And when things are a habit, it's a lot easier to go through it rather than say, look at yourself at the moment and say, I'm too tired to start, I'll just wait. But if you have that expectation set because it's routine, it's something that's you do every day, it's consistent, it's easier. And sometimes there's lack of motivation. This one you also have to kind of ask a little bit more about where does that lack of motivation come from? Is it because you're having mood issues? Some people, it will be anxiety, depression, apathy. Maybe it's fear of falling, so you would rather not do anything to risk falling. And obviously, if that's the case, I prefer to have your mood issues addressed with your provider. Some people do not want to use a walker. And I can understand why. However, it's your perspective that you should take, because people who don't want to use a walking device, whether it's walking stick, walker, they view it as a negative. Okay, maybe perhaps using it you feel is a failure on your part, or maybe you think it's admitting that your disease is advancing, but that's not how I view it. I always tell people it's not a negative. It's to prevent falls, because falls can be nasty. They can lead to hip fractures. You can hit your brain, hit your head, and end up with a brain bleed. And that's detrimental. And that's what you do not want, because some people will not recover from those. And even if you're fully recovered, you may notice that you're not quite where you were before the fall. And so in a way, your disease has advanced. So for me, walking aids, if that's a way to prevent that problem. So that's the reason why I don't see it as a negative. It's a tool to help you be active. So you just got to flip your perspective around and don't view it as a negative feature. It's something that's there to help you. It's a tool. We're lucky that somebody developed the walker. Utilize it. Okay. Again, having a consistent exercise routine helps. You don't feel like doing it, but guess what? It's 8 o'clock. Got to do it. Okay. And you do have to get creative, especially nowadays. I fully recognize during the pandemic, it's really hard. People aren't able to keep the routine that they had. I have so many people who worked so hard to have a consistent routine, and now they can't do it. Gyms are closed. They can't walk outside because it's winter now. But get creative. There's online classes. I did list our UCSD exercise class there for you. One thing that I usually see is underutilization of the caregivers. They will say, I have no one to walk with me. And I will in turn ask the caregiver, are you not allowed to walk with this person? And the answer is usually, no, I can walk with that person, but they don't. So I'm like, okay, well, there you go. Instead of sitting there looking at your phone, walk with that person. So utilize whoever is around. So, I mean, I see that quite a bit, actually. And I do understand there's other barriers, too, that prevent people. Maybe you can't walk outside where you live, because you live on a hill or whatnot, but get creative. A big issue is not taking your levodopa on time, which then means you have suboptimal motor control. And some people will take levodopa based on how they feel. And in general, that's something that we don't like. We like people to be on a consistent schedule so that your motor control is tip-top shape. If you're not using an alarm, invest in one. If you feel like one of the barriers for you to taking your levodopa on time is that your medication regimen is too complicated, talk to your provider about it. Maybe it's time for you guys to talk about DBS or Duopa or some sort of other medication adjustments. So I wouldn't just say, hey, it's too complicated. I just prefer doing it my way, because sometimes that's all it takes to make you be able to walk better and give you the motivation to be able to exercise, because you're feeling better as a result. So other tips that I try to give people, you want to set realistic goals. I don't want you to say, I have to do an hour exercise every day right off the bat. Some of you can achieve it, but there's going to be a lot of people who it's going to be too overwhelming. They're not going to be able to reach, and then that's how you give up. So I would rather have you start small and gradually increase it if you can. So even 5-minute walk every day, I'd be happy with that. We do aim for you though to have at least 20 to 30 minutes of exercise most days of the week, and preferably to include some cardio aerobic exercises, because that way we can get the brain oxygenated and whatnot. And you don't have to get fancy. People are telling me, I don't have a treadmill. I don't have access to the gym. And again, get creative. Do something that you like. Don't do something because somebody else did it and it works for them. Because if you don't like it, you're not going to continue it. So a simple thing as walking. I think some people think they have to run or do something really aggressive. You don't have to. Just simple walking. If you walk 20, 30 minutes most days of the week, I would be very happy. And that's why I'm really grateful for Rocksteady Boxing because of that, because they are an exercise that I think I can really say most of my patients have really enjoyed. And physical therapy is another one of my favorite. I'll commonly hear patients say, "Oh, I did it." I'm like, "How long ago?" They say, "2 years ago." And I know they exercise already, but if you go to a good therapist, they can tune you up. And so that's what I tell people. And that's why I like the therapists. I prefer therapists who know how to work with Parkinson's disease because they know what that tune up means. They'll look at you and say, "This is how you were last year. I see that you're still pretty good, but this is where you can work on, longer strides, whatever it may be, better posture." I have to admit, this is not as useful for people who don't specialize in Parkinson's disease. But if you have a therapist who knows you and knows that what your goal is long term, and they get it, I think a physical therapy referral. I would, if it were me, I'd do a tune-up every year. So just because you've done it doesn't mean you can't do it again, and it doesn't mean it won't be helpful. And it could just be one visit. If you think it's not helpful, that's fine. But at least you went for that one visit.
They can also come to your home through home health.
Yes, it could be outpatient, it could be home physical therapy. And we're very fortunate in San Diego to have a lot of, well, I shouldn't say a lot because it's not a lot, but we do have Parkinson's specialists. But it's a lot to compare to other areas where they just know neurology. But even people who say, "I know neurology, so I know Parkinson's disease," even them, sometimes I don't find them very helpful. But if they say, "No, I'm a Parkinson's specialist, I know LSVT, I know power," I'm all for that. And they're very helpful. So the next thing I always like to work on is cognitive health. This one is not as simple just because due to the lack of treatment in general. So it's difficult because we don't have good medications. And so some people don't really know what to do to affect your cognitive health. But I feel like there are variables that you do have influence over, whether you recognize it or not. So in order to optimize your cognitive health, these are things I think you should try to keep an eye on. So poor sleep, and again, poor sleep, REM sleep behavior disorder. If you're not sleeping well, you're tired, your brain's just not going to work as well, okay? And so take that over-the-counter melatonin. I do recommend good sleep hygiene, which is theoretically you're not supposed to just use the screen, look at any screen time before you go to bed. So do something different, like reading perhaps, or a puzzle. Regular times to go to bed and wake up. That's very helpful. And again, that goes back to having a regular routine. Regular routines, people tend to do better with that. And again, we're going to talk about poor mood control. And you'll notice a common theme throughout my presentation, which is why I wanted to focus on this as a foundation. And it goes between that whole body and mind connection. If you're not sleeping, your mood's not good, your physical condition will be affected, and vice versa. It's all interrelated. So poor mood control. Some people, they look like they might have dementia, but it turns out they're just depressed or anxious. And if that's the case, we do have medication treatments for that, and counseling and therapy when appropriate. I'm always on the lookout to make sure that people are not socially isolating themselves, because that's an easy slippery slope to get into. And you have to further investigate that to find out why. If it's a mood issue, you treat the mood issue. However, it's not always that simple. Or, not a mood issue. Sometimes upon further investigation, the person may say something like, "Well, they can't hear me, so what's the point?" Or maybe the person can't hear the other people talking. And which is ironic, because that in turn can then lead to depression, which then makes the social isolation even worse. So if you can investigate to find out why is that person not involving themselves in social interactions. If it's hypophonia, where your speech is way too soft, do speech therapy. If it's because they can't hear the conversation to be able to interact and hear and respond, make sure that they get their hearing aids inspected or get new hearing aids if they don't have any. And the data behind social isolation, it does show that social interaction is very good for your cognitive health. And I would much rather have people maintain their social interactions rather than playing like brain games. I feel like socialization is much better for cognitive health than, you know, forcing yourself to do a crossword puzzle that you don't even enjoy. Again, we talked about long-term uncontrolled orthostatic hypotension. So what the theory is that hasn't been proven yet, but there is a hypothesis that makes sense. The idea is that orthostatic hypotension, let me go back to the definition. And I'm sorry I didn't explain this earlier, but orthostatic hypotension is when you're sitting and standing, your blood pressure is a certain level, but then when you stand up, your blood pressure drops because of gravity. Why that happens is because in Parkinson's disease, your autonomic system isn't working as well as it should be. So the automatic controls to keep that blood pressure up when you stand up is gone. So your blood pressure instead drops. That's why people feel lightheaded, because instead of your nervous system pumping the blood up to your brain, it's making the blood pressure drop, and so you feel lightheaded. And the goal is to keep the systolic number, which is the top number, to be 100 millimeters of mercury. Now, the hypothesis that people have that has not been proven in studies yet is that if your blood pressure drops below 100 multiple times, I think one or a couple of hits here and there would probably make no difference. But they believe that multiple hits over a long term leads to these white spots, white matter changes. Almost like ischemic changes, because if you're not getting blood to the brain tissue to keep them healthy, it's basically an injury to the brain. So if you have multiple mini injuries to the brain, cumulatively, the idea is that it could affect your cognition. So there is research going out to prove this, just because we like to prove things before we tell people that we know this is for sure. But I think a lot of neurologists do keep an eye on this because they know orthostatic hypotension is a big problem in Parkinson's disease. So that is another variable that you can control. If you have lightheadedness, tell your providers. There's medication treatments for it. In terms of conservative therapy, make sure you're hydrated. If allowed, add more salt to your diet, and that helps raise your blood pressure naturally.
Kathy, I have a question before you go to the next slide. With over-the-counter melatonin and people with Parkinson's, what's a start dose that you would say is recommended?
It's not really. Yeah, I mean, it depends. I mean, I don't think there's really any conclusive hard recommendation for that. I mean, because they come in so many different sizes. Right. I've seen them come in 1 milligram, 3, 5, 10. So you could start.
Yeah, if somebody starts it, what's
5.
The standard? 5. Okay.
5, yeah,
and if that didn't work, do you recommend doubling it or easy enough?
So you keep increasing it by 1 capsule, whatever size you have. Okay. You keep increasing it by 1 up to 20 milligrams maximum.
Got it.
We use it up to 20 milligrams. So, and the reason why I don't like to give a dose, because I don't want people to go out there and drive themselves crazy to say, Kathy told me 5 milligrams. Right. It has to be 5, and I only found 3. I'm like, take whatever you can get. I mean, if you need more, we just double it. And if you know that 10 milligrams works for you, at least next time you need to be on the lookout for a 10 milligram tablet. But it's pretty common that 20 milligrams is the maximum, though.
Got it. One other thing I wanted to comment about with regards to social isolation, I would just, and this is probably stating the obvious, but certainly during the pandemic, that has been huge.
Yes.
Most of you know John, and John is very advanced case. And so he is not someone who would spontaneously be able to carry on a conversation smoothly, although he certainly knows what you're saying. And pre-pandemic, John was out in the community at boxing, at San Diego State, at Audibility. And again, even though, for him to say, hey, hi, Kathy, is unusual, that interaction has been huge. And a week or so ago, I was on with him and had started to give him a supplement. And he just looked at me and he went, no. And I said, hey, babe, we don't need to do this. I mean, John's always had this very positive, proactive attitude. And he started to get teary-eyed and looked away from me. And I said, help me understand what's going on. And he said, clear as a bell, I'm so mad at the world. And this is a man who's never down. It's always, what can I do? How can I do it bigger, better? And I said, talk to me. And he said, friends.
Exactly.
And what struck me, and I'm sharing this with you guys, I mean, you may never be in John's situation, but John was somebody who always visited his friends who were ill. Even when he was having trouble walking, I discovered after the fact that he brought in a tiny friend, not anywhere near John's size, to help him schlep up a steep flight of stairs to visit someone who was dying of brain cancer. And I'm like, oh my gosh, in the midst of dealing with the pandemic and providing care, I had forgotten, yes, I'm around, a caregiver is around, but that social network. And does he have a best friend? Sure. But what has happened is people have dropped away because as the language has become limited, they simply don't know what to do. Mm-hmm. He does have a half sister who loves to talk and understands. She can call him on the phone and talk for an hour and he's thrilled. He's not going to come back with it. So I'm trying to kind of navigate this right now, but I've just decided, although Zoom doesn't answer all things, we're making up a list of friends and we're going to set up Zoom appointments and I'll call them and talk to them ahead of time and say, just talk, understanding John may be able to respond or he may not. But that moment where he was able to say, hey, I have nothing. Yes, I have my boxing through Zoom or San Diego State through Zoom or Audibility through Zoom, but I need that contact, that just one-on-one. So I just throw that out there. I think right now that's probably one of the biggest contributors to
I completely agree.
That we're dealing with Parkinson's.
I completely agree. And that's why when people ask me like what brain games I should play, I'm like, first of all, I want to make sure you're staying in touch with your friends. Mm-hmm. Because if you gave up that lunch just so you could play a puzzle, no, I want you to go back and have lunch with that person, pre-pandemic, of course. I actually have gotten a lot of visits because people just are not doing well during these times. Their exercise routine has been taken away from them. The socialization is much less, despite efforts to try to maintain it. We just can't forget. We just got to stay in touch. We just got to stay in touch with that. And like I said, it's a slippery slope, right? Because for 1 minute, it's like, I'll call you next month because it's a pandemic. And then 1 month turns into 2 months, turns into 3 months. And then one friend turns into 2 friends, turns into 3 friends. And you may not recognize that you're slipping into this social isolation. And then pretty soon you're depressed and not knowing why you're depressed. So I do keep an eye on that. If I notice somebody's lonely or whatnot, I try to keep an eye on it and just be like, hey, who's your support system? Because your support system needs to know this. No, I fully agree.
Yeah. And on that note, San Diego Central will be sending out a hard copy of their directory for 2021, probably within the next month or so. And that Tony, who's on with us today, is in charge of all of that. But, you'll remember people that you've seen within support groups when we were meeting live, and I wouldn't hesitate to, look through it. Oh yeah, I remember Bill. You know what? I think I'm going to give him a call. Just see how he's doing. Mm-hmm. You'd be amazed at what comes out of things like that. So just a suggestion.
Oh, I think it's a fantastic suggestion. So like I said, I'm going to keep harping exercise. If you guys don't get sick of me hearing it, I'm not doing my job. Exercise definitely promotes cognition. It promotes the blood flow and helps overall health in general. So you just remember, it's not just for your muscles, it's also for your brain in terms of cognitive and mental health too. In terms of cognitive health, again, it is very helpful to have a routine, but this time it's for different reasons. If you do have cognitive difficulties, the information that it's easier to process your day and information if there's less variables that you have to fight against. So that's why having a routine day, some predictability, helps you format anything new that comes along. And for people who have more severe cognitive issues, throwing them out of their routine can actually worsen their cognition temporarily. But in general, I think having a routine is good for multiple reasons, not just the reasons I listed for under exercising. So other tips to manage your cognitive health. A common complaint that I see or a problem I see is that people have a tendency to multitask. In the American society, we are people who take on too much. We like to multitask. We don't do one task at a time. But unfortunately, even as you age, with or without the Parkinson's disease, that multitasking does get more difficult. And that in turn leads to frustration. And it can be frustration from both ends, from the person with Parkinson's end, because they can't figure out why they can't finish a task, as well as from the care partner's end, where it's like, why do you have 10 projects? I asked you to do one and you can't complete it. And so what it all comes down to, though, is focusing. Again, you got to focus. And oftentimes care partners don't realize that this is a problem or that it's happening. So I tell people, pick one task and tackle that first, okay? And don't interrupt. If you need to interrupt that person, set a time frame of some sort. So say, hey, I'm going to give you an hour to work on this task, but just be aware I'm going to come by in an hour. Set an alarm, whatever you need to do to minimize interruptions, because that's how multiple things get started and nothing gets finished. And I see that get very frustrating for people, and it's not rewarding to them when they can't finish something. I do want to make a note about visual hallucinations. Sorry, that's a misspelling. That's supposed to be paranoia and delusions, not illusions. In Parkinson's disease, the hallucinations are visual. What a lot of people don't realize, though, is that you don't need to treat hallucinations. We only treat them if they're distressing to either the person with Parkinson's disease or the care partner, or it affects your quality of life or safety. If you are, lighting fires because you think it's a fireplace, if you are calling the police in the middle of the night because you think somebody's looking outside your window, those are times I would push for treatment of the hallucinations. But if you just see a cat and you're like, hey, there's that cat, whether you recognize it as a hallucination or not, if it doesn't bother you, I leave it alone. I do generally see, though, that paranoia and delusions need to be treated because they can escalate. Like I said, people have called 911. I've had people chase something down that didn't exist. So those I generally do see need to be treated. Okay. Now, taking care of your mental health. There still is a big stigma around mental health. But we're getting better. As a society, I think we're getting much better about talking about it. And I hope that within the Parkinson's community that we can just break that barrier, normalize it, because it is a symptom of Parkinson's disease. It's not just, sometimes it's something triggered, that's triggered by your situation, but it can in of itself be a symptom of Parkinson's disease. And we have to remember that emotions are normal. We're human beings. We were given the ability to have emotions. And so we need to understand that this is normal for us to feel the way we do. And mental health, again, if this is not stabilized, I also see this put people in a vicious cycle. People who don't feel well don't think well. And if you don't think well, you don't feel well, you won't exercise. You don't exercise, you get depressed. I mean, it's just all they all interrelate together. And so there's a lot of, I also see a lot of common ways this presents and the reasons for people feeling that their mental health is not optimized. A common one is losing your identity. You're not who you used to be. we have a tendency as humans to celebrate, especially, in America, we like to achieve things, right? We love to achieve things in ourselves, but we're so harsh when we change in ways that's deemed not desirable. But again, you have to recognize that we are human beings. We're fluid, and it's important to be able to adapt to changes. Whether it's a change you wanted for yourself or not, we have to change and recognize that, hey, luckily, we're human. We were given this ability to adapt. You just have to identify, how are you going to adapt to this change? Reassessment of your identity can be important. Some people get really locked into, I used to be XYZ, and now that I'm not that person anymore, I don't know what to do. But you have to look at it. I understand that identity was very important to you, but why does that have to be the sole reason for you to be happy? So sometimes you do need counseling to kind of work through these issues, and focus on what gives you joy. I mean, it doesn't have to be what you used to be or what you used to be able to do, but focus on the present, focus on the now, and find the little things that give you joy and focus on that and recreate that identity for you. That doesn't mean we're wiping away who you were 10 years ago. I mean, that's by no means what we're doing. People will always know you as the guy who could fix anything, or the person who, was top of his class. And people will always know you for that. That will never be taken away from you. But the thing is, the present is here, and we need to focus on what your identity is now and what brings you joy from your identity. I think a lot of people lose focus on that, and that can spiral them into depression because of that. And denial. I mean, I think we all go through this when there's a diagnosis given to you that you don't want. And that's why I like this picture that explains the grieving process, and understanding it, at least in my view, helps me to understand where my patients are in their process. That there's denial, where you act like nothing happened, and I'll hear it. I'll say like, hey, he keeps doing things like nothing's wrong. And then there's anger. You get frustrated at people. You lash out. There's bargaining. Hey, what if I do this and things will be better? Maybe what if I did something different? If only I had done this. So you're thinking you did something that you could have changed. And then there's depression. And ultimately, though, hopefully you'll get to acceptance, because that's where you can move on. Now, the reason why I like this picture is because the grieving process is not linear. And as you can see in this picture, you can go from one phase to the other and jump back and forth, back and forth, back and forth. You may be in acceptance and feel like, wow, I'm finally there, and then go back to depression. But that's okay. I mean, that's natural, and that's part of it. But the idea, though, is to not get yourself stuck in one cycle too long that you don't know how to get yourself out of it. And that's where coping skills come in. And you just have to learn what kind of coping skill works for you, and counseling and therapy can help you figure that out. Now, as I mentioned before, in Parkinson's disease, there's depression, apathy, and anxiety that can be a symptom of Parkinson's, because people will tell me, they're saying, I'm depressed and I don't know why. I have no reason to be depressed. It's the condition that's doing that to you. Whereas some people will say, I know I'm depressed because I'm no longer who I am. So sometimes you'll hear that pretty clearly. Now, if it seems to be more related to the Parkinson's disease rather than your inability to cope or your situational, something stressful happening in your life, you may need treatment. There's still that fear and stigma of treatment. People don't want to take more medicines, but we have to say, hey, is this something that I can work through, or is it something that needs medication? It's kind of like Parkinson's disease. We focus so much on the lack of dopamine, and we're willing to take the levodopa to replace those dopamine levels. But nobody focuses on the serotonin levels. If you have deficient serotonin, that's leading you to have depression, apathy, and anxiety. You need that replacement in serotonin. And so I hope for people to understand that, if you need treatment, it's okay to have treatment. It's just like, okay, we're replacing your dopamine. Allow us to replace your serotonin too. And again, social isolation. People can, like I said, it's a slippery slope. If people get into isolation, it can lead into a lot of mental health issues. Things you can do for yourself for your mental health: exercise. You have to exercise. For some people have told me that understanding Parkinson's disease in general it's helpful for them to know that they're not alone, to know that this is quote unquote expected or normal for the condition. If that helps you, we have a lot of good resources in San Diego for that. And again, make sure your sleep and your REM sleep behavior disorders under control. If you're well rested, you can feel better. And I do want to touch on a very sensitive topic, which is the family dynamics. And it's a hard conversation to have because some people don't want to so-called air their dirty laundry. But for me, if it affects the person with Parkinson's disease, first of all, why are we calling it dirty laundry? It's not dirty. It's normal. We're all stressed. We're all under strenuous circumstances that none of us wanted to choose. It was just put on us. So my hope is, people will reassess their family dynamics to understand how is it impacting each other. Because I do see sometimes that if this person could have a supportive relationship, they would be much happier. And everybody has their reasons for their family dynamics. Sometimes it's something that, maybe resentfulness from something that happened like decades ago. But the key is if you don't ever address it, this is not going to help people move forward. So hopefully you can reassess the family dynamics. And when we have, people, it could be anything from, problems with your siblings or problems with your parents. It's just, I see it a lot. And it comes in all sorts of colors and variety. So my hope is to say, hey, take a look at your family dynamic. If that's causing you a huge source of stress, are you willing to address it? And I will say, unfortunately, a lot of times this gets neglected. And I'm sure it's because there's not a lot of good resources out there, and you're kind of corralling everybody to get together to make changes within themselves to help the family unit. And unfortunately, I don't see this happening a lot. But hopefully with education and a little bit more awareness and a normalizing this, that people will get together and say, hey, the family dynamics is playing a role on everybody, and we need to improve it. My wish for everybody would to get family therapy, but I know that's not always feasible. So it is a very sensitive topic, but I hope you bring it up. Just bring it up, just all out in the open. There are, family secrets, and I don't want so-and-so knowing what, and we all know secrets aren't good for you. Let it all out, and it helps everybody in the family. It helps the person with Parkinson's disease. So it helps everybody move forward. But I do see that it's a big problem.
Kathy, I have a question.
Yeah.
Are there within, say UCSD, VA's realm, therapists who are familiar with Parkinson's and would be available to our community should someone want some counseling, or, the care partner feels that they need someone to work with because their spouse who's got Parkinson's is in denial. Mm-hmm. And if so, where, I'm thinking, I'm kind of mentally processing out loud. I realize we, meaning the Parkinson's Association, probably ought to have a list, just like we have a list of movement disorder specialists, mm-hmm. perhaps a list of resources for getting that kind of professional support from people who have a knowledge and an understanding of Parkinson's.
Yeah, sometimes I'm kind of scared to talk about these topics because I hate to say something and not be able to back it up all the way through. But the reality is the mental health care professionals, particularly with clowncy, is severely lacking. Mm-hmm. And it turns out it's actually a worldwide problem because we have doctors who travel And they're constantly asking people in different countries, how do you deal with your mental health care issues? Psychiatrists are easier to find, but generally they just focus on medicine. You know, they're not there to provide counseling. If me and a person feel that yes, counseling is much needed, and insurance, you know, like even if I did have somebody, what if insurance won't cover it? Medicare is notorious for not covering that kind of stuff. So if you're lucky enough to have good insurance, because let's say you're still working and you have private insurance, that's a little bit easier. But most of the time people have to look for it on their own. And then that's the other problem too, is compatibility. I was using, well, I still do, help therapy. Have you guys heard of the help therapy? So they actually provide counseling within your home, and they do cover Medicare. So when I first heard about it, I was very ecstatic. I was like, wow, this is exactly what we need. The problem though is the therapists, some of my patients, they're like, well, I appreciate it and I can see why it's helpful, but it's just, they didn't click with the therapist. And it's really important to click with the person. So it's hard. And I don't know why they didn't click. And sometimes people can't tell me. They're like, I don't know why. I mean, they gave me good advice. They gave good follow-up, but I just didn't feel like they knew me or whatever it may be. So I still use them just because they're the best in terms of insurance resource that I have. And they go to your home. I mean, that's like the best part too. But I can't say that they understand Parkinson's, and I can't say that I've gotten great feedback from them. But if I need them and it's better than nothing, I really utilize them. I've been with UCSD since 2011, and I have been begging people to work with our population and try or refer me to people. And we do get referral lists that they're like, hey, try these list of people. But it all comes down to the same thing. They won't accept insurance. They're too full, so they won't accept new patients, right? The other complication I see too is actually the accepting new patients is a common one. You know, they'll say, oh, I'm accepting new patients. And then 2 months down the line, they're like, nope, we're done. And I don't know if we impacted them or not, but maybe we referred too much. We have an easier time with psychiatrists though, but I'm definitely still looking. And that oftentimes that's the reason why, you know, you have to kind of look into your insurance first to see if it's a covered benefit. And if not, are you willing to pay for it? So, because even Parkinson's Association, San Diego, for a short time, they were offering counseling and then that went away.
Yeah, that was a program where you could see someone who was already licensed and or you could work with an intern, and the cost was like $10 an hour or $10 a session. And that, just listening to you from your perspective, you know, I'm thinking, gosh, that may be something for us to, again, at some point in time, look at as a resource.
Yeah. The one thing I did get about that was that people don't like seeing a different person every time. And that was the problem with the interim. It wasn't the same person every time.
Interesting. John worked with an intern for probably 9 months, and it was the same person.
Oh, then he got lucky then. Okay.
Yeah, and then switched to the person taking her place, then switched to a professional, and that was not a good match. Switched,
but they're from the same agency, right? Or there's, so that's what makes it hard.
And then switched to another professional, and that was excellent. And then the program closed down.
And that's the same problem we've been having. You know, we find somebody who says, I'll work with your patients, and then they say, nope, we're not accepting more patients, or I'm no longer accepting insurance. So it's definitely a huge source of frustration.
Or like UCSD social workers, is that a route to go, or it needs to be more like a psychologist, neuropsychologist, psychiatrist?
So I can't speak for all facilities. Our neuropsychiatrists actually only administer cognitive testing. That's it. They do a very good job counseling you. So remember I told you cognition, physical, mental, they all tie in together, right? So one of their assessments during the neuropsychological testing is to give you a survey on your mood. And if they feel that you have significant mood issues that's impacting your cognitive scores, they will counsel you, but it's a brief counseling of, and I have patients who get really excited because they're like, wow, he said I needed this, I needed that. I totally agree. I love the guy, but then they can't come back for a follow-up visit because that's not their purpose. You know, and same thing with our social worker. Our social worker will give talks about mood talks, and they're like, wow, can I schedule an appointment with you one-on-one? But that's not her role. Well, her role is to be a community resource rather than a counselor per se. So yes, it's a huge hole that we have. I think we've done a great job in San Diego collecting all these resources, but that is the one area that I cannot succeed in.
Well, it's good to know, because certainly it gives, you know, nonprofits like us something to focus on and look at how we develop a system countywide, whether it's revisiting what the association offered previously or looking at what didn't work with that, and how we might provide something. Because it's not just a matter of getting the counseling, but having somebody who truly understands what is now recognized as the most complicated disease out there. And that requires somebody who's taken the time to learn about it, and move forward from there. So
that's the problem. It's already difficult to find a counselor or therapist. Now you're asking to find a counselor and therapist who specializes in Parkinson's disease, right? And so that's the frustration. And I've even volunteered. I said, you don't need to know Parkinson's disease. I will teach you. I will teach you for free. Just please help me from, you know, but again, it's the biggest challenge I've had with this job.
I had a psychiatrist come up to me at one of the Parkinson's Foundation's annual walk a year and a half ago. And she introduced herself to me, and I thought, oh, well, she said, I'm, you know, in South Bay, and I understand Parkinson's, and I am Hispanic. So I immediately went to our group leaders that, you know, focus on the Hispanic group. And I went to try and find out who she was, not having, you know, taken her card. I just was like, oh, you need to go see, you know, so-and-so. And then when I called them and said, okay, do you have her name and contact? Well, they didn't. And so I realized, again, something like that, if I find out, probably ought to hold on to it and then broadcast it within our system.
But then again, she's a psychiatrist though, right?
True.
So she's just going to give you medicine and be like, get better coping skills, and then leave it at that. And you're like, well, what does that mean?
And my question is, if you're a psychiatrist and you're starting to prescribe medications, do you truly understand, you know, if the person is having episodes of psychosis, that you're not going to give them a standard antipsychotic because it'll suppress dopamine? And that's where I get really, really concerned in terms of recommending a psychiatrist. I want to know that they know what they're doing with Parkinson's.
Yes. And that's the thing. I said, I'll teach you all that. But again, it's hard. It's a field. I mean, if we get success, it'll be for a few months, and then we're back to square one, unfortunately.
And I will just put it out there. If anybody has in their own journey come across a therapist that they really like, or know about, have heard about, let me know.
Yeah.
Let me know, because I can certainly, you know, I can share that with Kathy and with others. You can even email me anonymously, text me anonymous. I don't care. Because that is, I think, as Kathy's pointed out, this is an area of need. We're very fortunate in San Diego. We have a wealth of movement disorder specialists, which is huge. You know, you go over to Imperial Valley and it's your primary that you're seeing for your Parkinson's in most instances. So we're really strong with regards to movement disorder specialty, but as Kathy pointed out, not with so much with the counseling aspect in terms of resources. So something for us to look into.
Yeah. And again, I try not to focus on medicine so much sometimes, and counseling is what's needed, but that's the embarrassing part. Yeah. The embarrassing part is, how do I follow through with my recommendation? So a big, so in terms of, okay, so since we talk about counseling, what if you can't get counseling? Well, there's other ways that you can manage your mental health if you need it. Basically, what you're trying to do is find something that's therapeutic, something that's a stress reliever for you. Fortunately, mindfulness therapy, it has been pretty popular. And there are resources online. There's classes that you can pay to do if you need a little bit more guidance, but there's a lot of online resources for that. I mean, even if you did something like Rocksteady Boxing, to me, I think that's therapeutic. And actually, people have told me that's better than any counseling or psychiatrist they've ever seen sometimes. And I think it has a lot to do with not just only the physical part of it, but and they do challenge you from the cognitive part with the multitasking and whatnot. But the camaraderie, I mean, that's the core of the foundation that I'm trying to explain, is that that's what you need. And I, in my opinion, I think that's why Rocksteady Boxing was so popular. It wasn't just, hey, do these 10 exercises, do this exercise and give me 10 reps. It's not just about that. I think that's why they were so successful. Support groups. Some people feel that the support groups like this one is plenty to help them cope with whatever they need. I love the support groups that are just for people with Parkinson's disease, and then there's support groups for caregivers. And then there's combined ones. I love the variety that we have in San Diego, because you can pick whichever one works for you. And if music therapy, there's big talk. You were saying about audibility, John, and audibility. If music therapy is what works for you, there's tremble clefs, where you can also work on your speech. And again, that has camaraderie with it. Whatever works for you. It doesn't have to be talk counseling, but the idea is, what can I do that's therapeutic? And I wanted to put in a special note regarding future planning, just because future planning is a source of a lot of stress that I see. And if your plans for the future, you're comfortable with it, it does provide a good ease of mind. And I'm going to go elaborate a little bit more on that. So the one thing that people always worry about when they are diagnosed with Parkinson's disease is all the uncertainty that comes up. All the plans that you've had for your future, all of a sudden need to be adjusted. There's finances involved. What about my loved one? What about my home? What about this and that? And I see a lot of people who push future planning aside end up in crisis mode. So what you don't want to do is end up in crisis mode, because you can't think clearly when you're in crisis mode. You don't want the dominoes to fall on you. And that's why I like this picture. You don't want the dominoes to fall on you. You want to be the one to push the dominoes down. You want control over it. Now, can we stop the dominoes from dropping? No, but you can at least control which direction they go. And that's the reason why future planning, to me, I felt was important for this, just because a lot of people do neglect this. Whether it's the denial, or I'm too busy, whatever it may be, I do think it's worth setting aside time to develop a plan, so that way when emergency does come up, it's a controlled crisis. It's not crisis mode where you're like, I don't know what to do. So that's why I feel like this is very important. So obviously, if you're prepared, stress is much reduced, allows everyone to focus better, and therefore make decisions better. So that's why planning is. It's very reassuring, especially if you are faced with hard decisions to make, and it increases your confidence in handling emergency. And most importantly, in my opinion, it avoids strain on the family relationship. To me, I view the Parkinson's unit very highly. So any strain on the family, I feel can be detrimental to living well with Parkinson's disease. So that's why I like to focus on family a lot. Sorry, trying to get this thing to move forward. So most of Parkinson's disease, as we know, is managed on an outpatient basis, but hospitalizations can occur, such as if you have a hip fracture, if you have aspiration pneumonia, and unfortunately, it is common knowledge that the hospital setting does have a lack of understanding regarding the nuances related to treatment of Parkinson's disease. So a lot of that has fallen on the patient to be prepared. And that's one of the reasons why I'm involved in this inpatient protocol that Nancy brought up in the beginning, is to help providers understand that your medicines need to be on time, that you can't be given certain antipsychotics, but you can also advocate for yourself The Parkinson's Foundation does provide an aware and care kit. Within that kit is a lot of useful items. There's a booklet that you can read that focuses on your preparation and what you need to be aware of if you were in the hospital. There's a medical bracelet. There's a few different resources regarding medications that are contraindicated, medicines you should not take if you have Parkinson's disease. There's a small medical card that has that. There is a pad, and you can rip off a fact sheet that you could just give to your providers. So it's really nice that they have different elements, and that comes in that handy bag. There's a card that says, hey, I need my medications on time all the time. And I saw one sheet where you can list special considerations, such as if you have swallowing issues, and these are the special diet that you are on. If you have problems that they should be aware of, such as orthostatic hypotension, so they don't get shocked if they see really low blood pressure, or if you have cognitive issues and hallucinations. And if relevant, they do have a little resource card related to DBS and Duopa. So the idea is if you have to go to the hospital, you would just grab that bag. You can also include things yourself, such as your maybe extra set of medications, maybe your advanced care directive, which I'm also going to talk about in a bit. So it's a nice bag that has room for other things should you want it, and you just grab it and go.
If you don't, just to jump in, if you do not have a kit, and with this group, I think most of you probably do, as I do, but if you do not, email me, because I have kits here and I can drop one off to you. They are now charging $8 shipping and handling. You can order it online, but with the bag, they're now charging, and that's as a function of the pandemic. So if anyone needs one and they don't have it, just email me.
Another nice resource too is the Vial of Life. This one is, I don't know if they make you pay shipping, but I know it's a free item that you order on the website. In there, there's a form, and you fill out relevant information such as your name, date of birth. They include things like, do you have a pacemaker, special considerations such as, are you hard of hearing or deaf? You can put in your medical history, doctor's information. And what you do is there is I don't know if you can see it on here, but it's like a little vial that fits that form, and you can put other things in it as well, such as your advanced directive. And the idea is they direct you to put this. I don't have a recent one, so please excuse me if I'm wrong, but they direct you where to put it. And so this one says to put it on the top shelf of your refrigerator door. And then there's a sticker that's provided. That's this red one right here, that you stick it on a specific spot. Again, this one says on the front upper corner of your refrigerator. And the idea is the medics, when they come, you call 911 and they come, they're supposed to look and see if if they recognize that sticker, they know to go get that vial. And this one, that way some of your important information will follow you as they take you to the hospital. So this will help you be better prepared for the hospitalizations. Now I wanted to get into some of the legal documents that I feel is important for future planning. And I recognize this is a hard discussion for some people. I know it is in my family, because a lot of people think this should only be discussed if somebody is near end of life, which is actually far from the truth. I think this conversation should take place very early, regardless of what your health is. I have an advanced directive, for example. So my hope is, again, that we normalize this uncomfortable topic to talk about and tell people, no, it's normal to talk about what I want for my end of life. And to tell you the truth, if you really think about it, that's actually a privilege to be able to say, this is what I want for myself. So you can decide for yourself, do you want medications to keep your heart pumping? Do I want a ventilator to help me keep breathing if I can't breathe for myself? Do I want dialysis? Do I want a feeding tube if I can't swallow? Do I want to donate my organs, including my brain, which I know a lot of people with Parkinson's disease are really interested in that, to help further research. Parkinson's disease and hopefully, contribute to a cure towards it. So I know there's a big interest in that. And so to help me normalize it and for me to help other people normalize it, I tell them, I think it's as basic to me, and I know I'm biased because I'm in the medical field, but to me it's as basic as me saying, hey, how do you like your coffee? If you can't make your own coffee, how much creamer do you want me to add? How much sugar do you want me to add? I would be angry if my husband gave me coffee black. So let me tell you that. I do not like black coffee, but I want lots of sugar and cream. So just think of it that way and to hopefully normalize this so we can have this conversation. The documents for advanced directive can be overwhelming, but there's lots of resources out there to help you fill this out. So what the word advanced directive is, it's a legal document that explains the medical decisions you want made for you in case you cannot speak for yourself. And there are different components that you can add. The living will is actually where you list out, this is what I want, this is what I don't want. So this is just like your wish list. It's not an order. So a doctor can't take that and say, oh, this is for me to follow. What it's meant is to help whoever you designate as your power of attorney, which we'll talk about, to help guide them in their decision-making process. A DNR order, a do not resuscitate order, that's just for CPR. Do I want CPR or not? The POST, which is the physician order for life-sustaining treatment, that is an actual doctor's order. So the doctors have that order in their hand, they can follow through with your treatment. And usually, though, that's only activated when immediate treatment is needed. Most importantly, in my opinion, besides listing your wish, is the power of attorney. This is the person you designate to legally speak on your behalf. So this can be a power of attorney. You could designate it for separately or together. It could be finances and or healthcare. They can be the same person or not. But the important thing is who's going to speak for me in regards to matters. This is particularly urgent if somebody is developing cognitive decline, because ideally you want these documents set up when you are sound of mind. And this is particularly important for people who are partners and not legally married, because I think it's really heartbreaking when a person's partner ends up in the hospital and they find out they have no right to make decisions for them. And so what happens is that it goes to the next legal person, such as their child. And if you don't get along with that child, or that child has different views from you, that's where, again, the family dynamics just clash and it makes it terrible. And of course, there's always a financial planning, estate planning too. Sorry. Okay. So again, like I mentioned, I tell people start early. I'm not saying that you're end of life. I'm not saying that this is doom and gloom, but it's one thing to get out of the way and put everybody's mind at ease. It's also important to start early so that you don't spring surprises on people. Okay. So if you are designating your child over your partner to make decisions, I mean, do you really want them to find out the hard way? So I think it's important to have a family meeting so everybody knows, it has expectations set. Allows people time to process the information. So that's why starting early is very helpful. Again, you want to avoid a crisis mode, which I see a lot, unfortunately. And if we can avoid crisis mode and everybody's on the same page, the person with Parkinson's can feel supported rather than see that their whole family's falling apart. That makes me so sad when I see that. In your moment of crisis, you should be supportive. The patient should feel supportive, not see everything fall apart around them. Okay. And in terms of future plan, I also like to tell people that you have to reassess household responsibilities. What that means is oftentimes I see one person solely responsible for XYZ. So when the other person has to jump in, they can't do it. And then, or they don't know how, they're overwhelmed, whatever the reason may be. And so that's not something that I think people should do at the last minute as well. Oh, he's always taking care of the finances, so I never bother checking. And then all of a sudden you become responsible for it. And again, you end up in crisis mode. So I always tell people, reassess what needs to be taken care of within your household. It's always a good idea to, whatever legal documents you have, keep additional copies and in an area where your designated people can find them. And it is a good idea to reassess your forms every now and then, just to make sure you want any updates added to it. And with this, I think if you were ever to enter a crisis, you will be much better prepared. Unfortunately, I've had people who were not prepared, and what they'll do is they'll have an unstable father on a ventilator, and they're calling all the hospitals to transfer this person just so they can get a second opinion. And I have to stop them and say, stop, think about this. You're panicking. And so I would much rather have you be able to think clearly in crisis mode than sit there and panic like that, because it doesn't help anybody. So hopefully that gives you time to think about what's important to you and set your foundation. Now, to build on that foundation, I think in order to make, living with Parkinson's disease 2021, get involved. Nancy said it. We are so lucky in San Diego to have so many resources nationally and locally. And we have specialists, we have organizations. You can get so much general education in the community. There's so many support groups with little subgroups, such as a group specifically for a young onset, a group specifically for newly diagnosed, a group for caregivers, a group for just a person with Parkinson's disease. I feel very fortunate. There's lots of research going on in Parkinson's disease, fortunately, and you can definitely participate in that. There are observational trials, which is more about understanding how Parkinson's develops, or or biomarkers, for example. And so observational studies is not meant for treatment. It's meant more for how to understand Parkinson's better. For example, the Michael J. Fox Foundation, they had a huge study where they would check people's blood, MRIs, lumbar puncture, to see if there's a way that we can detect Parkinson's earlier rather than wait till you say, hey, look at my tremor. Is there any way we could develop better diagnostic tools? Therapeutic trials, that's where they try to come up with new treatments, such as the antibody trials that are currently going on right now. We're lucky we have April as our Parkinson's Awareness Month. The tulip is our Parkinson's disease logo rather than the color of the ribbons. We have really fun walks. I really miss those, and I can't wait until those come on. We have the Parkinson's Foundation one is usually north of us, like Orange County area-ish. We have one right in San Diego, so get involved with those, and hopefully, life will get back to normal soon, so we can actually be there in person rather than doing it virtually. It's just not the same. I always feel like if I give a talk about Parkinson's disease, it's never complete unless I talk about the care partner, because obviously it's a unit, and you can't talk about Parkinson's disease, the person with Parkinson's disease, without talking about their partner. Because why? Because the caregiver burnout, well-known phenomenon. It's such a huge problem with people, whether they're aware of it or not. It can cause so many issues for the person themselves. Pretty much a lot of the same issues that we talked about earlier with the person for Parkinson's. You can have mood issues. You can have, you can get sick yourself. You can have sleep problems. And I would say that, some of the things I mentioned earlier could apply for the person with the care partner as well, too. And we need the care partner to be well, just like we want the patient to be well. So I try not to forget the care partner whenever I'm with the person. It affects quality of life. So there's lots of reasons to make sure we keep an eye out for the care partner as well. And this is especially a problem if the person has cognitive issues, because the care of the person is that much more complicated. Now, common issues I see within the care partner. believing that you can do everything yourself to the very end. Or maybe you feel like a burden, so you don't want to ask for help. Now, you may be able to do a lot of it in the beginning, but I will tell you, it's hard to do it all by yourself as the years go on. So what I try to do is I try to normalize the idea of getting help. I don't want people to say, oh, I don't want to be a burden. I don't want this and that. And no, just ask for help. Make it sound like it's completely normal. What we don't want to do, which unfortunately happens more than I want to see, is that the care partner suffers in terms of, mood or health, ends up in the hospital. And that's when action is taken. And I don't like waiting until that point to finally address the caregiver burden. I just don't have time. I'm so busy. So, but I hate to say this, but you're just going to have to do it. You're just going to have to take time for yourself. If you keep saying, I'm going to do it, it's never going to happen, because there never is a good time to start. You just do it. And again, make it a routine. If you add it into your routine schedule, it does help, particularly if the person with Parkinson's gets really anxious if the care partner's not there. You can just say, hey, that from 9 to 10, I'm golfing. You know that. And just incorporate it, make it a daily thing, something that's habitual, and just do it. And hopefully, when we say take time for respite, hopefully you're doing something you enjoy, not doing house chores, catching up on finances or errands. And I know, I completely recognize that's easier said than done, but you need something to decompress yourself, or else you will burn out. And this is another frustrating, a lack of resources for help. That's actually a very frustrating one for me, because that's not something that I can give you. The best that's available out there is if you happen to have Medi-Cal and you qualify for in-home support services. But other than that, I really don't have much to offer, because caregivers, you have to pay for them. I mean, there's very little help out there for that. But fortunately, though, we do have the Southern Caregiver Resource Center, who has they have a respite program, so they will help. And this is pre-pandemic. They would have programs to entertain the person, and then the care partner could have time to do whatever they wanted. And I can't emphasize this enough. I mean, I hate to say this, but you've got to utilize your resources, but you have to use your village. What that means is accept help, find help, ask for help. And I hear a lot of, well, I don't want to burden my children. I don't want to ask this, but sometimes if you are struggling that much, you have to enlist the village. They always say it takes a village to raise a child, but they never say it takes a village to take care of each other. And I don't know why. If you really think about it, how is that any different? So just get help however you can. And again, you do have to get creative with your resources. Sometimes a social worker can help point you in the right direction. Another reason why for caregiver burnout, when people don't want help, is they don't want to lose that feeling of control. They want everything done exactly a certain way. And for some of it's for good reason, especially if a medication has to be given a certain way, or blood pressure has to be done a certain way. But I do see some caregivers, everything has to be done in a certain way. But if it works for you, that's fine. But if it's causing stress, where I'm noticing that you're suffering from it, I'll have to tell them, hey, make sure you keep your perspective clear. What is the goal? The goal is to keep the person safe. So sometimes there is something you have to give up. It may not be exactly the way you do it, but as long as it's not something that's going to harm him, let it be done however it's done. And just keep in mind, as long as that person's safe, that's all that matters. Some people do need counseling, and again, counseling and therapy for helping understand why the need for control. How do I let go of that control?
I would just add, Southern Caregivers Resource Center does provide counseling to caregivers. Last I checked with them, there were 6 sessions that were available. So, for example, when I first was caregiving with John, I was also caregiving another family member simultaneously. And I called them and set up a file on John and Mom. And then they helped me navigate resources. Their respite program they offer one, and so does Coast Care Partners. And it's a subsidized program through the county. So right now you can get a caregiver for X amount of time for $15.74 an hour. And the county subsidizes it and picks up the balance. And I literally, because I'm down 3 caregivers right now, so it's just John's lead caregiver and myself, I have just signed up for Coast Care's respite program and am getting help 1 day a week for 8 hours. Do I need to be around because John's on a couple of different pumps and for medication and feed? Yes, I do. Because you will not find an agency, since they're under the Department of Social Services, not the health department, their caregivers cannot administer medication. Okay, they're not allowed to.
Yeah, and those are the circumstances that you can't avoid, for sure.
Right, but you can always hire privately as well. Care.com is a resource. You pay for a subscription and then you can post jobs there, which is what I typically do. Obviously, with the pandemic, things are a little different right now, but there are certainly people who are out there looking for work. So that's another resource as well.
Thank you. So just other general tips, again, with the whole physical and mental health, sometimes you just have to take care of yourself. Exercise. That mantra should be for everybody, with or without Parkinson's disease. If you do need to hire help, but resources are tough and you can't find anybody else to help you, I usually ask people, can you at least hire somebody so you can sleep? Because sleep, again, is so important. So at the minimum, sleep, so that way you can function yourself during the daytime. And you too, we have to remember, you too are going through a grieving process. So if you need to grieve, allow yourself to go through those steps and recognize that that's normal for you to be grieving, because it's hard when your roles have changed. You were a couple and now you're a care partner. And that change in role is tough. It's tough to see the person that you met is no longer that same person. So, you have your same process, a grieving process that you have to go through too. I do find it helpful for you to talk to somebody about your role, particularly the changes, and that could be anybody. That could be within a support group, that could be with your friends, but just talk about it. And there's, again, education. There's lots of education. The Southern Caregiver Resource Center, one of the reasons why I really like them is because they help provide education on how to manage somebody with cognitive impairments. Tips and helpful. Do I acknowledge hallucination? Do I not acknowledge hallucination? What do I do when they don't recognize me or get upset? Just basic non-medical interventions, and that's why I really like them. And I think the most important, this is the last one is the most important for me. It's very simple. It may seem very cliche, but it's true. You want to find joy. The problem is we get so wrapped up into being consumed with this condition that it feels like every hour of every day is dedicated to this condition, that we lose sight of what brings you joy. And that's the reason why it's so important to maintain social interactions. Continue activities that you enjoy, and recognize that you're going to have good days. You're going to have bad days, and the good days, you embrace them, and the bad days, you just got to say, just tough it up and it'll pass. We have had some care partners who said they wish they had spent the last moments, enjoying each other's presence rather than focusing on what was wrong. And they didn't get to really enjoy each other and appreciate each other. So, maybe find some way to capture the good memories. Somebody brought up the idea of a picture book, which I really liked, scrapbooking or whatever you want to call it. Find some way to capture those moments and to remember, not because what I don't want is for you to remember the bad times. I want you to remember the good times, because this is a great person. I mean, otherwise, why would you be there to care for them? You've been with them for X amount of time for a reason, because they're a good person. And you want to remember that. So find the joy that you can, despite all these obstacles and all these adversities that come your way. So that way you can remember the person for who they really are. Okay, so I hope that helps you provide a foundation for 2021. And if things just feel out of control, just bring it back to the basics. That's what I told you. Bring it back to the basics. And don't worry about anything more complex than that. And then when you start from the foundation, and then you can build up from that. So hopefully 21, good luck to everybody 2021, and we will make it better. Okay, we will.
Kathy, thank you so much. That was really comprehensive. Again, you can see the wealth of information that she has and the perspective from a person dealing from a medical angle with Parkinson's. She sees a lot, an awful lot, in varying and in sundry degrees, and I think it's we were very fortunate to have her take the time out of her day to do that.
Absolutely.
Any questions before we sign off? Otherwise, Kathy, thank you.
Thank you.
very much. Thank
Okay,
you.
have a good year, everyone.
Thank you
Okay.
very much.
John.
Thank you.
Take care.
Happy
Thanks,
New Year.
Kathy.
Thank you, Kathy.